Put the system on trial. Health over wealth. Our suffering for their millions. Slogans that were plastered on walls, posted online, and chanted at rallies across America after the shooting of health insurance CEO Brian Thompson in New York in 2024. Police reports say the words deny, defend, depose were etched on the bullet casings from the gun used in the killing. The same words were chanted at protest rallies in the weeks after Luigi Mangione was arrested. What do these slogans mean, and what have they got to do with a murder on the streets of New York? I'm Jordan Dunbar. This is the Mangione Trial podcast from the BBC World Service. A father of two is shot dead in broad daylight in New York. A young man charged with murder, and his face goes viral. The reaction to the killing of Brian Thompson and his suspected killer, Luigi Mangione, has been unprecedented. This podcast takes a step back to unpick the facts and conspiracies, and will explain what happens in court. If you have heard of a claim you want us to fact check or a question for us to tackle, email us at themangione@bbc.co.uk. Or for WhatsApp, you can scan this QR code. The shooting has added even more energy into an already heated debate about the healthcare system in the United States. In this episode, we're going to be looking at the issue of health insurance in the country. So much of the incredible response to this trial is coming from people's opinions and experiences of the healthcare system. It is a massively emotive issue. Despite denying the killing, Luigi Mangione became a figurehead for some of those who want reform of the health insurance system. Lots of the comments you have left us about the case have been around this. So in this episode, we're going to ask why it's such a divisive subject, break down the facts, and look at how the system works. To do this, I'm joined by Neda Tawfiq, the BBC's New York correspondent. Neda, give me an idea of where the US sits globally in terms of healthcare. Is it good? Is it bad? Is there medical care for everyone, or universal coverage, as they call it?
Well, there's no universal health care, but we do have some of the best medical facilities, physicians in the world. So there's really a lot to unpick when we discuss healthcare in this country. We're the only high-income country without universal coverage, or essentially, the guarantee that people can get medical treatment, medicines, without suffering real financial hardship. People might have in their countries a public health system where the government fully funds healthcare and coverage. But what we have here actually is a system that relies on a really vast network of private medical facilities and insurance providers. And the government does step in to help the most vulnerable, but that system also means that you have a lot of people who are uninsured. And there's been a lot of kind of studies looking at how much the US spends on healthcare compared to other countries. In fact, we spend about twice as much as other countries, but we don't necessarily have better outcomes.
And I believe the industry regulator itself describes it as massively regulated.
Yeah, the AHIP, which is an industry body for health insurers, actually points out that every single aspect of insurance is regulated or reviewed by state insurance commissioners and federal regulators. So we have to keep in mind, right, that the federal government steps in, but also states step in to fund certain programs. But that means that the costs for things like premiums, out-of-pockets, deductibles, terms we'll get to later, I'm sure, all of that needs prior authorization from public programs or from specialists.
Yeah, it's already got complicated with those phrases that you mentioned. So it seems like on the one hand, you have absolute world-class facilities and physicians, but only if you can access them. So what I want to do is talk through the system. There's a lot of phrases we've said that people might not understand. So let's attempt, Neda, deep breath, explain how the US healthcare system actually works. And I say attempt because I think you'll agree it's a very complex system.
It really is. And look, I've lived in this country my whole life. I've worked in this country. Um, and it really depends on what kind of health insurance you have. And even then, there are so many questions. So let's try to kind of break it down into, I guess, four groups, you could say. You have employer provided health insurance. So people can get a job and they are insured through insurance companies that have a deal with their company, an arrangement with their company, but those people even still have to pay for that insurance through their paychecks. You also have veterans who have fought for the United States, and there is the Department of Veteran Affairs. They have a special kind of medical benefits package. The government pays for their insurance. There's also some facilities that they can go to specifically for their needs. And then you have something called Medicare. Medicare is actually for older citizens, 65 and older, also for anyone who is disabled. And that federal system really just was set up to ensure that they do have access to care. Then you also have people who are insured on Medicaid, the unemployed, for example, children, for example, who aren't covered through their parents or guardians.
Okay, so according to the KFF, who are an independent source for health policy research, in the US, 60.4% of people under 65, so about 165 million people, had employment-sponsored health insurance in 2023. So let's focus on how that employer-provided system works. So, Netta, I'm American. I've just finished school or college, and I've got my first job. What happens now? How do I get insurance?
So you've likely spoken with your employer about what they can offer you. Employers have deals with insurance companies to provide for their employees. If you're a new hire, likely you have to wait between 1 to 3 months before you're even eligible to go onto your employer's healthcare program. But after that, you pay what is called a premium. And that's the amount that's deducted from your salary just so that the insurance company will cover you.
Okay, so that sounds simple. I pay my premium, it comes out of my salary, but then there's things called deductibles and coinsurance. What are those?
Yeah, and let me just tell you, because I'm actually in the stage now of every year we have to kind of re-enroll into what plan we want to choose for insurance. And it really is this complicated system of getting out your calculator and looking at how much you could end up paying. And that depends on a series of things. The first one is something called a deductible. Now, that's the amount that you will actually pay for your medical care before your insurance even kicks in. So, for example, some plans could have a $0 amount deductible, so the insurance can kick in right away. Other times, they'll want you to spend up to $2,000, $5,000 before the insurance feels they need to come and kick in. Then you also have what's called a copay. Now, this is the amount that if I just want to go to my doctor, for example, my regular primary doctor for my annual exam, I will still have to just pay that copay, $25, $30 to go see them at their office. But then to make it more complicated, we have something called coinsurance. Now, after I've reached my deductible amount, it doesn't mean that I'm not going to pay anymore, that the insurance is going to pay 100%. There are times where I will have to contribute, and that is a percentage that is usually about an 80-20 split. But again, it can depend on the individual plan. So on top of my deductions, on top of the premiums I'm paying, the copays, you could still pay about 20% of your medical bill. Now, people might think, wow, that's a lot, but there's just one other point to mention. There is in policies something called an annual out-of-pocket limit. So that means it's the most you'll be required to pay for your medical expenses in 1 year. So, for example, if I've already paid my deductibles, my copays, and my current coinsurance, and I've reached that amount set by my plan, which is, say, $4,000, then the insurance will finally kick in and pay the full 100% of the remaining costs.
So I pay my premium through my wages, and that's essentially access to the insurance. Then a copay, I still have to pay if I go to the doctor or show up at the hospital. Then my deductible is the amount I pay before the insurance kicks in. And even then, I'll still have to pay a certain percentage on that, say 20%. Is that right?
That's right. And that's why for so many people, just getting healthcare can create a lot of anxiety.
Netta, can you give us a breakdown of how that money is spent, where it goes?
Sure. Well, the AHIP, the industry body we mentioned earlier for health insurers, actually sent a breakdown of where the money is spent because ultimately they're the ones paying out these claims. Now, according to them, on average, 24 cents in a dollar goes to prescription drugs. 40 cents is to hospital costs. That's, emergency rooms, inpatient, outpatient costs. 4 cents on administrative costs of filling out paperwork and doing all of that. And they say that only 2 cents of every dollar is actually profit for them in the insurance industry. And we've also seen from other studies that the cost of U.S. healthcare is so high, really because of the costs of physicians and medical facilities.
Netta, let's talk through how this process works. I want to keep it simple. So I show up at an emergency department. I think I've broken my arm. What happens then?
Well, first you have to decide, how bad is it? Is your bone coming out of your arm? And the reason I say that is because you can either go to an emergency room in a major hospital, or you could also go to an urgent care center. And those are open 24 hours, and they're less expensive, essentially, than an emergency room. And often you kind of pay up front when you get to those urgent care centers. So that's the first consideration. But once you get there, you're going to have to give your insurance card to the person checking you in. And that just really gives them the ability to bill your insurance, to know what you're covered for. Now, if you aren't in a real emergency like this case, you have a broken arm, you could have them check with your insurance to get pre-authorized for any treatment you might need, any casts you might need, to know how much that's all going to cost you up front, so there's not any surprises. Because quite frankly, some policies have different costs depending on where you go. And if they are what you call in network with your insurance company and have an agreement on how much they're going to be billed and how much they're going to pay that facility versus an out-of-network facility that has no such agreement with your policy. So all of that factors in to how much you're going to end up paying.
Okay, so what happens when I get treated and I get sent the bill? Who pays at that point? Is it me or is it the insurance company?
Well, first, the insurance company will get the bill. And the insurance company that will then provide you with something that's called an explanation of benefits. And that's when they break down all those terms we talked about. Here was your deductible. Did you meet your deductible yet? Here is your coinsurance if you are responsible for paying any part of this bill. Here's what we think the doctor should get paid for this. And again, if they have an agreement with an in-network provider, then that doctor knows how much they're getting anyway. But if it's an out-of-network provider and the doctor sends a bill and the insurance doesn't think he's owed that much, then ultimately it's the patient that gets stuck with that. So there are different prices, as we talked about, for different hospitals, different physicians, different, doctors with different specialties. So all of that kind of factors in. And once you get that explanation of benefits from your insurance company, you'll then know what you're on the hook for to pay to the doctor if anything's left over.
This might be a naive question, but do I have to pay for the ambulance as well?
Absolutely. That is another factor that people here deal with, whether they can get to the hospital on their own or, like I said, go to an urgent care facility if they're not really in a life-threatening situation, because those bills for ambulatory services get quite high.
What do you do, Netta, if your claim is denied? Do you have to just pay it yourself?
No, you can certainly appeal. And part of that is really having your doctor write to the insurance company and justify why you need that ongoing treatment. And that can be quite tedious. It can delay care for a lot of people who are just kind of stuck in limbo, waiting to see if ultimately through the appeals process, through their doctor sending in additional scans or additional evidence to prove they need that care. Yeah, it's a real question if that person will ultimately have insurance pick that up. And if they don't, it then leads people to really ask difficult questions about how they can move forward. The first thing that is recommended is if there is a massive bill, that you first go to your insurance company and make sure that they are absolutely paying for everything they are supposed to under your plan. And then secondly, check that you're actually being billed for things you should be billed for. If all of that fails, you can appeal to the doctor or the facility to try to lower that payment, explaining, that you didn't anticipate that not all of it would be covered by insurance. Now, that doesn't always help, obviously, because physicians want to get paid for their services, and so do facilities. Sometimes they'll work out kind of a payment plan. But if all else fails and someone is really panicking about the amount they're expected to pay, they can go to their local representatives and complain if they think it's unfair. So, one of the stats said that in 2023, for example, they had more than 650,000 disputes filed. But ultimately, there's no guarantee that any of that is going to work. And so there have been real stories of Americans going bankrupt because of healthcare costs. And just to point out, it's not just people who get their insurance through their employers that will go through this. You also have those who have Medicaid, for example, insured that way. And so the KFF says that of qualified health plans sold through healthcare.gov, that's the healthcare marketplace where people can purchase plans, that on average, 20% of those people's claims will actually be denied. Now, the AHIP, the industry body that brings together health insurance companies, responded to that claim. They said that they rarely take into account the overwhelming number of claims that are submitted from doctors that have extensive gaps in accuracy and don't have a completeness of information provided. And so they say that kind of skews the numbers.
Yeah, and we invited them to join this conversation, but they said they were unable to because of the high volume of requests they've got for interviews. So they gave us this statement. In the fragmented and heavily regulated healthcare system, health plans, providers and drug makers share a responsibility to make high quality care as affordable as possible and easier to navigate for the people we collectively serve. Health plans are working to protect patients from the full impact of rising costs while connecting them to care that is safe, evidence-based and coordinated. Neda, the phrase deny, defend and depose has come up a lot since the murder of health insurance boss Brian Thompson. What does that actually mean and where does it come from?
Yeah, this is a phrase that became really commonly used among critics of the insurance industry. So let's break down the terms one by one. The first, deny. Well, that's what we've kind of been talking about, just insurance companies refusing to acknowledge that a patient needed certain care and deciding not to cover it, just rejecting a claim outright. Then you have defend. And they say that that is essentially the insurance company just doubling down and justifying their denial, even if that means going through the legal system to do so. And then you have depose. Now, this one's a bit more complicated, but it implies removing people from the company who, don't always agree or don't go along with opposing a claim. So the word literally means to remove from office suddenly and forcefully. Now, again, the AHIP says some media coverage and phrases like this laid the blame for what they see as a costly, complex, and difficult to navigate healthcare system solely at the feet of insurance companies. And they say that that has created a lot of misinformation, a lot of misunderstanding, led to really negative public sentiment toward the industry.
Thank you, Neda Tawfiq, BBC correspondent in New York. We are going to come back to you later. So much of the reaction to this trial has been around the health insurance industry in America. It's long been a divisive subject, and the murder of health insurance CEO Brian Thompson re-energised it in a massive way. So in this episode, we've been looking at how the American system works and why it's such an emotive issue. Let's hear from someone who's experienced difficulty in getting healthcare firsthand. April. Hi, April. Thank you very much for speaking to us.
Thank you so much for having me.
So April's daughter was 6 when she started experiencing severe behavioural problems in 2021. April, tell me about your daughter's symptoms and then her eventual diagnosis.
So my daughter started experiencing really a vast change in behavior overnight, pretty much. She was attending school and everything was fine. Then she got COVID, and we noticed after that she just started having severe psychiatric problems that were out of the blue, such as ADHD type symptoms, severe separation anxiety, panic attacks, things like that, which typically don't come on that quickly and abruptly, and it was really overnight. So it took us a while to try to figure out what it was, because it's a pretty rare condition called PANS. But once we were able to finally get the diagnosis, it took even longer to find a doctor who could treat it, and then get, even further to find treatment for it.
I mean, that's really tough on your daughter, but I'm sure it was also incredibly difficult on you as her mum trying to get that diagnosis and then get treatment.
Yes. It's, I kind of say that it breaks a part of you when you see your kid fall apart and become someone she's not supposed to be. And I think the hardest thing initially was doctors didn't believe us, really, when we would come in and we would say, no, she really is having these extreme problems. And it was really hard.
Because it's a really rare condition. I mean, fortunately, most people won't go through. But April, for you having to find specialists for such a rare condition, that can't have been easy.
It was not. And I think that one of the hardest problems was that even our local children's hospital, which is one of the largest children's hospitals in the southeast of the United States, wouldn't treat or help us in this condition. So that was really challenging. And then I was calling all other, research hospitals and children's hospitals local to us. And the closest one was in Arkansas, which is 9 hours from us.
Okay, and once you got the diagnosis, you have to go for pre-authorization, right? Because you can't just go ahead and get treatments, because then you risk having to pay for it.
Correct. So the way that the process works is we met with her doctors. They decided that a trial would be a good treatment for her. It just hasn't been officially FDA approved yet. So the physician then submits a prior authorization, is what it's called, for the treatment, because the treatment is extremely expensive. And so we want to make sure that the insurance company will cover it. And initially, our very first prior authorization, the hospital that submitted the treatment plan did not select the correct in-network specialty pharmacy that's in-network with UnitedHealthcare. And so it was denied for over 3 months, I believe, as we were fighting with them over the correct pharmacy just to order the drug from.
And that's an important point, because many insurance companies have a list of approved providers, and these are hospitals or pharmacies that they have a prior agreement with, and that's called in-network, right?
Correct, yes.
The KFF, an independent think tank, have looked at the data available from all providers. They say in 2023, insurers reported that 92% of all claims were in-network, and of those, 19% were denied. Out-of-network, meaning claims where an approved provider, such as hospital or pharmacy, were not used, 37% of those were denied. So if you're trying to get a claim through that isn't with a pre-approved supplier, it can be harder. So April, once the claim had been resubmitted with a pharmacy that was in-network, meaning it's pre-approved with your insurance company, what happened then?
So then they wanted they argued site of care. So we corrected that. And so then another prior authorization was submitted with the correct pharmacy and now the in-home infusions. So then that was submitted. And then after that, it was denied for medical necessity. And so that's the last 2.5 months of the battle was over medical necessity.
What does that mean?
That means that despite my daughter's expert physician putting in that this is the treatment that my daughter needs, the insurance company comes back to say, no, it's not. We don't think so. We don't feel like it's medically necessary, or there's not enough data to prove that it's appropriate for your child to do. And this is where a lot of patients get stuck on this part because they have their own internal documents of things that they find medically necessary. And if there is a rare condition and you're not listed within that, they will deny it and say that there's not enough research proving that this treatment works.
So this is a rare condition that your daughter has, but it's taken quite a long time for you to even get to the second denial, hasn't it? How long from when her symptoms first presented to getting to this point of the second denial was this?
I mean, years. It had been years, at least 2 years that we had been trying other therapies, antibiotic treatment, steroid therapies, IV infusions of antibiotics, IV of steroids. Nothing was keeping her stable.
And so after that, you started appealing this decision, the denials, and you upped your campaign. Tell me about how you got to the point where you did get treatment covered.
So we had really reached the end of our options. The hospital told me in late November that they were going to no longer pursue the appeals process because UnitedHealthcare wasn't giving them anything to work with. But by this point, my doctor had completed 4 peer-to-peer reviews, which is where he gets on and speaks with a physician, trying to argue our point of the fact that my daughter needs this treatment. And they had still denied everything. So they told me that they were no longer going to pursue the treatment. I was introduced on a Pandas Facebook page to a company called Claimable. And it is a new company that they're using AI to help patients write appeals. And they had kind of found the Pandas community and knew that a ton of these kids were getting denied and that we all really needed help. So they offered to help me write an appeal letter. And we submitted a 23-page appeal document. We sent it to everyone. We sent it to our governor. We sent it to our insurance commissioner. We were sending it to everyone. And we started basically posting about it on social media to try to get their attention. And we finally got the call December 23rd that they were going to approve it.
From when your daughter got sick to actually getting treatment and it getting covered by the insurance company, how long did that take?
That was probably 4 years.
And if you don't mind saying, how much do you think you spent yourself, as in out of pocket? How much do you think you had to spend?
So in those 4 years that we have been dealing with this, we have spent probably over $40,000 out of pocket to treat her.
How did you feel then when you got the call to say that this treatment's going to be covered and your daughter can keep getting it?
Obviously, like, huge relief. This was more than an inconvenience. This is my daughter's life. And she continued to get worse while we were waiting on this approval. So it was relief, but it was bittersweet too, because I was still angry. I was upset that it took this long.
And this whole experience, has it changed how you feel about the American system, about the healthcare system?
Absolutely. I definitely think it's broken. And there needs to be some sort of intervention. I'm not 100% sure what that would look like. But I can tell you that, we are a hardworking, middle income, regular family. And, we pay a lot of money for our insurance each month. We pay almost $1,200 per month for our premiums. And so when you're paying that much into something, you expect that it will be covered, especially for a treatment that your sick child needs.
And what about now? How is your daughter doing now?
We are getting there. We are having small improvements in some of her symptoms. She seems to be sleeping better, which sleep disturbance was a really big part of her long term. But, we have a couple more months of treatment to go. So I'm hopeful that it continues to improve as she gets more treatment.
April, thank you so much for speaking to us. Really appreciate it.
Happy to be here. Thank you so much.
We asked April's insurance company, UnitedHealthcare, about her case, and they told us, "We truly empathise with families who have children dealing with complex medical conditions and rare diseases. We conducted a comprehensive review of whether to cover an experimental therapy that is not FDA approved for the treatment of this condition. We decided to cover the therapy under an exception, which provided access to a treatment that would otherwise not be covered. These circumstances are rare and not representative of a typical experience. In total, we pay 98% of all eligible claims. For the remaining 2%, the majority are instances where the services did not meet the benefit criteria established by the plan sponsor, such as the employer, state or centres for Medicare and Medicaid services. Less than 0.5% of claims are not approved based on clinical evidence and patient safety. We recognise there is always opportunity to improve the experience for the people we serve, and we learn from situations like these to do just that." They added, "The family's provider did not appeal the original decision for more than a month, which is one of the core reasons that the timeline between initial denial and approval seems so long. We met all required appeal timelines." And the hospital April mentioned, Arkansas Children's, told us it protects patient confidentiality by adhering to federal privacy laws as part of our unyielding commitment to safety. We work closely with every family who needs support navigating insurance appeals processes and champion the best and most effective treatment for each individual child. I'm going to bring back Netta now, our BBC correspondent in New York. Netta, we heard from April there, and she was going through a very difficult time because her daughter had a rare condition. But have you heard of people with more common conditions and ailments being denied care?
Yeah, absolutely. And I think a lot of this comes down to what kind of health insurance plan you have, because people who have great health insurance can often go right to a specialist. They don't even need a referral, from a primary doctor. And so that kind of streamlines the process. But others have to get referrals. They have to really prove that they need the care that they're seeking or that they are suffering enough to get health care. So that is why we really talk about the kind of unequal nature of health coverage in this country.
Who's calling for reform, and broadly, what reforms are they asking for?
Well, look, I think generally everybody's asking for some kind of reform. It's interesting to see how the politics have really shifted, because if you remember, there was a lot of talk about repealing the Affordable Care Act, but that has really gone away. Republicans were the ones who were really kind of campaigning on repealing it, because in general, they want to see the government out of insurance. They want to see private medical facilities and private insurers take the lead with healthcare. But as the Affordable Care Act became more popular, we don't see, for example, President Trump now threatening to take away the Affordable Care Act. And in fact, he's promising voting not even to change Medicare or Medicaid, those entitlement programs that the government offers for vulnerable and older Americans. And so in America right now, Democrats want to have, if not a fully kind of public healthcare system, to at least get more individuals insured and under government subsidized programs. But there is this big issue that Republicans who are currently in power, President Trump, wants to push through more tax cuts, wants to push through a budget. And their critics say that despite the kind of promise not to touch Medicaid or Medicare, that to make the savings needed, those plans might be affected.
And it's important to reflect at this point, even health insurance industry bodies accept the system isn't perfect.
That's right. I mean, you have a lot of stakeholders in this system. Physicians, they want to get paid a certain amount. States, federal government, they want the ability to kind of be able to negotiate doctors' billing and rates when it comes to getting down Medicaid and Medicare costs, for example. All of this, when you talk about the pharma industry as well and the costs of medicines, all of this factors in. It's about how do you maximize health outcomes for Americans? How do these people who need to make profit in what essentially a private industry, whether it be insurance companies, doctors, how do they also benefit in the system while also the government can keep down its costs? It really is a big web, a complicated web.
Yeah, Nada, thank you so much for helping us try and navigate it. I mean, it's clear this topic isn't going to go away, and the debate on how Americans get healthcare is only going to get louder as this trial goes on. That's it from this episode of the Mangione Trial podcast from the BBC World Service. Thank you for watching. Make sure you subscribe to the World Service YouTube channel so you never miss a thing. If you have heard of a claim you want us to fact check or a question for us to tackle, email us at themangione@bbc.co.uk or WhatsApp us. Just scan this QR code.